This is a great question, one that's been researched for many years. What causes food allergies? So when somebody has a food allergy, that individual's immune system sees that particular food, for example, peanut, and thinks that it is something harmful for the body. And this is because the individual has been exposed to that food in a way that made the immune system think that this was something harmful rather than something innocuous that wouldn't cause any problems. So when the individual then gets in contact with that food, say peanut, by eating it, or if it goes into their eye, or if it's rubbed onto their skin where they have some exposed skin, they could get an allergic reaction because their immune system has already recognized this as something that is foreign and needs to be dealt with. So the reason why people develop food allergies has been looked into in terms of the exposure through the skin hypothesis. So there are quite a number of studies now that suggest that if a child has an inflamed, disrupted skin barrier in the first year of life, that they are potentially exposed to the food in their environment, onto the red, inflamed skin, and that due to this, the immune system picks up that food as something that is harmful to the body and then starts to mount an allergic response to it. So my top tip for those suffering from food allergies would be to get a proper diagnosis so that they know exactly what it is that they're allergic to. So for example, somebody could have a reaction to scrambled egg, but think that they're allergic to the egg, and it could be the milk that was used to prepare the scrambled egg. So it's very important to get some proper allergy testing, which can be done by skin prick testing or a blood test using specific IgE testing. So once you have a proper diagnosis, then you need to have a good understanding of the types of allergic reactions you might have. You could get an immediate reaction, which would cause hives and swelling and potentially anaphylaxis if it's an immediate allergy, or it could be a delayed allergy, in which case it would cause symptoms later, a few hours after eating the food, and that could be skin rashes or eczema or gut issues. And so you need to know how to identify the types of reactions that you're going to have and how to manage them. So the first thing would be to stop eating the food that's causing the issue and to ensure that you know how to look for that food once you know what it is, with reading labels properly, etc., telling people that you have this allergy so that they don't give it to you inadvertently. And then you need to know how to manage it. And so in terms of having a proper emergency plan, particularly for those with immediate food allergies, that has the right medication. And then it's also important to make sure that if you have a food allergy, say, for example, to milk, and you're avoiding cow's milk in your diet, you need to make sure that your diet has enough in the way of calcium and vitamin D, because you may lack those nutrients if you're not having much in the way of cow's milk. So it's important to look into that to make sure that nutritionally your diet is complete, and that's even more important for children who are still growing. Whether the body can be trained in getting rid of food allergies is something that has been intensely researched in the last 5 to 10 years. So we know that with immunotherapy for inhalant allergens, for example, for grass and house dust mite allergy, that you can take injections or tablets or drops under the tongue, and that can help to retrain the immune system to be less allergic to those inhalant allergies. Now, when it comes to foods, in terms of certain foods that are naturally outgrown, for example, most children outgrow their egg and milk allergy. So there are things that can be done to help that individual outgrow their milk and egg allergy more quickly by introducing, for example, baked forms of that food into the diet. But this does need to be done under medical supervision rather than just at home. Then there are certain foods that are more persistent. So for example, only 20% of children outgrow their peanut allergy. and only 10% of children outgrow tree nut allergies, such as cashew and walnut. So once a child has that allergy, usually they remain allergic for the rest of their lives. Now, there is very exciting new treatment available now for peanut with the licensed product, Palforzia, and there's a patch test coming along as well. But this is something that is rapidly expanding in the field of food immunotherapy, and it is now available in certain clinics to various foods. Now, the question whether it actually gets rid of food allergy is really important, because a lot of the media has been portraying this treatment as a cure for food allergy. Now, what the studies have shown is that it does not cure the food allergy, because the person doing the desensitization or oral immunotherapy program, it can be called both, they need to continue taking that food every day for the rest of their lives. So it's not something that would be defined as a cure. A cure would be that you no longer have to think about eating that food. You can just eat it whenever you want. So it is something that we say will make that individual bite-proof. So they can, for example, if they're peanut allergic, they could have some peanut by mistake if they went out to a restaurant, and they would be much less likely to have an allergic reaction. And also, if they were to have an allergic reaction, the studies have shown that it is much more likely to be a milder allergic reaction than if they were not taking this treatment. So when it comes to food allergy symptoms, you have two types of food allergy. You have immediate food allergy, which causes hives and swelling, potentially itchy runny nose, potentially vomiting, and in most severe cases could lead to problems with airway or breathing or consciousness. Now, for immediate food allergies, if the symptoms are, for example, skin rash, hives, or swelling, then using an antihistamine, for example, a non-sedating antihistamine such as cetirizine, is a good treatment for those symptoms. And these can be bought over the counter in children over the age of 2 years, because it is licensed from that age. However, for children under the age of 2, this would need to be prescribed. Now, in terms of the more severe symptoms, such as problems with your airway, breathing, or circulation, it's something that needs to be treated with adrenaline. And adrenaline autoinjectors are not available over the counter. They do need to be prescribed. And this is the gold standard for treatment with anaphylaxis, which is a life-threatening allergic reaction affecting airway, breathing, or consciousness. So in this situation, an over-the-counter medicine would not be the right thing to use. And that's why it's so important that if you have a food allergy or your child has a food allergy, that you see somebody who's able to diagnose this properly and give you a proper emergency plan, help you to recognize the symptoms and how to manage them in case of an allergic reaction. Now, when it comes to delayed allergies, the symptoms may be an eczema flare or maybe some gastrointestinal issues. For an eczema flare, many good moisturizers are available over the counter. And the National Eczema Society has some great information about this. And then if the skin becomes very red and inflamed, there are some topical steroids that can be applied. Some of these are available over the counter. Some need to be prescribed. When it comes to the gut and symptoms associated with the gut, it's very much about removing the offending food from the diet to see if that improves the symptoms. Sometimes some people can use an antihistamine like the non-sedating antihistamine I mentioned before, like cetirizine, and that may help. But in terms of the main treatment for that, it would be to stop eating the food that's causing the symptoms.